Hi, my name is Linda Borgmeyer, and today I would like to talk to you about whole body vibration as a tool for improving your outcomes in rehabilitation. Specifically, I'll be speaking about the Galileo whole body vibration machine that comes to us from Germany because it has 375 studies, medical studies, and this is the tool that I use in my practice. I think it's important to understand how the Galileo whole body vibration came about. It wasn't a copy of somebody else's machine. You know, there's a lot of whole body vibration machines out there touting the science that was done on the Galileo. But the Galileo was set apart because it was part of a diagnostic and therapeutic concept. So Novatech of Germany came up with this idea that we're probably teasing out and treating muscle problems separately from bone problems, but they're really related. So the first item they came up with, the first test that they came up with was the PQCT. And that measured the relationship between muscle and bone. And you'll see a video on this in the next slide to explain how that works. So now they understand, okay, what's the muscle-bone interrelationship? It would talk about bone density and muscle bulk. And then they said, okay, so now we see it. How does that play out? So how does that play out as far as muscle function, motion, power? And so they came up with the Leonardo Mechanography. And that tests the actual function of that muscle-bone relationship that they discovered in PQCT. Then they said, okay, this is great. We now know that there's a relationship between the two. We now know how it plays out functionally because we have all these tests that we do, and the Leonardo is actually a force plate, wonderful piece of equipment. And then they said, okay, but what are we going to do about it? So that's where the therapeutic concept came up of using whole body vibration to work within the confines of what they've discovered about the muscle-bone relationship, and that's when they came up with a Galileo, and it's side alternating, and we'll talk about that later in this video. So down below, you'll see that there are three different pictures. There's the two on the end are the same type of units. They're side alternating mechanostimulation that you stand on, sit on, lie on. But the center one is actually a handheld system that does a similar thing to the body that the whole body vibration, the Galileo, does in standing. So we're going to go through all of that in more detail, but I just wanted to make sure that you understand that this was not a copying somebody else's prototype. These are the originators of the whole body vibration that is now, taken craze around the world, but it is made in Germany. STIM Designs, you'll see down here on the bottom right-hand corner, is the US and Canadian distributor. So before we delve into the science, I just want to go over a few contraindications that have to be excluded before you use the Galileo with your patients or with yourself. Pregnancy, you should not be pregnant and get on the Galileo. Acute thrombosis, artificial joints in the trained region. So you could train the lower extremities if you had a shoulder replacement. But you can't train the lower extremities if you have a knee or a hip replacement. Acute inflammation, swelling in the joints. If somebody's really in that acute stage of anything, you want to let the body heal first before you start working the muscle system. Acute tendinopathy in the trained region, again, acute inflammation, don't want to do that. Acute hernia, acute intervertebral disc problems, fresh fractures, gallstones or stones in the urinary tract system because they could be dislodged, post-surgical wounds and fresh wounds in trained regions of the body or incomplete wound healing, rheumatoid arthritis when they're in the flare-up stage, and epilepsy is really just a precaution, and it would be a precaution for anything that we do because if the person were to have an epileptic seizure, you would have to make sure that they were safe. So you would never leave somebody, it's just a precaution, you would never leave somebody on the training without you being there. So basically, if you are able to do exercise, you've been cleared to do exercise and you don't have any of these listed contraindications, then you should be allowed to use the Galileo. So what are the indications for using the Galileo training? So if you need to train muscle power or muscle strength, if you're recovering from immobilization or an injury, if you have muscle contractures or spasticity or even low tone, we'll go through the science so you can understand how could you train spasticity and tone out if you're using the same machine. I'll explain all of that. Prevention of osteoporosis, balance training and prevention of falls, coordination training, muscle atrophy, loss of muscle bulk, back pain, poor circulation, pelvic muscle training, remember pelvic floor is a muscle, stress incontinence therapy, diseases of muscular origin, and chronic pain. And I know that seems like a diverse group of indicators for treatment on using the Galileo, but when I explain the science, you're going to understand how this one powerful piece of equipment is able to meet the needs of all of these different indications. There are some special functions that only the Galileo has that I want to talk about today. So the Galileo has smart coaching, which continuously checks whether the foot position is correct for the frequency that's set. So if you're bouncing around, say you step out to number 3 on the board and you're bouncing around, it's going to slow your machine down. It's going to show you the picture of these feet with the arrow saying you need to move your feet in. You're not in a good position for this. And this really helps with making sure that efficient training is done. So it really is like having a coach in the room, making sure that you're making good contact and that you're training as efficiently as possible. The Galileo also has something called wobble function, and effectively it can train balance and coordination because it randomly changes the frequency. So this is what it would look like on your board. The speed and the degree of frequency change depends on which level you pick. So let's look at level 1. It says it changes the frequency 2 hertz every 1 to 4 seconds, either up or down. So if I start at 20, I'm either going to go up to 22 or down to 18. And you can see that it changes more frequently and to a greater degree as you move through the different levels of wobble. And you can also set up custom wobble settings. This is great for, as I said, training balance and coordination. So as a therapist, knowing that the Galileo has 375 independent peer-reviewed and published studies was really important to me, because it's important that whatever I bring to the table for my patients, that it is proven to work. So the efficacy is there, it's strongly associated with the product, and the Galileo met that requirement of mine.
This is Kada. She's 15 years old. She needs a wheelchair to get around because she suffers from spina bifida. For the last 6 months she has been a patient at the University of Cologne Hospital. This is 9-year-old Jasmine. She has suffered from brittle bone disease since she was born. Till now she hasn't learned to walk. Getting back on your feet, that is the aim.
Hoch. Und feste, feste bis unten. Gut. Und nochmal.
The Cologne concept for the treatment of bone and muscle disease was developed in the pediatric department of the University of Cologne Hospital. Till now, muscle and bone diseases were treated individually. Our concept is original in that both diseases are diagnosed and treated as an entity. Various medical establishments have cooperated during the development of these new diagnostic procedures for the analysis of muscle and bone development initiated by the Cologne concept. During the examination of the bones, their structure is made visible and the density of the bones is established. The arm is presented as a cross-section in layers. The grey areas inside both of these bones displayed here are bone defects. A healthy bone looks totally different. It is a lot denser, which can be recognized by the red colouring. The principle of bone development diagrammatically represented. Different sorts of cells work together. Red, the bone-degrading osteoclasts. Yellow, the bone-building osteoblasts. The process is regulated by the strength of the muscles which mould the shape of the bones. No stable bones can be formed without sufficient movement. The more active or sporty a person is, the more muscles stimulate bone growth. Osteoblasts add external matter so that the diameter of the bone increases and therefore becomes thicker and stronger. The so-called DEXA bone density exam analyzes the composition of the body consisting of bone, muscle and fat. The precise measurements of these parameters is crucially decisive in the therapeutic effect and success of the Cologne concept. An especially important part of the diagnosis is the exact determination of the functions of the muscles, their strength and performance. The Leonardo force platform is used for this. The measurement shows how much leg strength Kader can already develop when she tries to stand. This will be checked regularly in the course of the therapy. The concept of functional muscle-bone unity developed by the Cologne work group has a special significance for those who have to use wheelchairs. When it comes down to it, we have to deal with two illnesses. The original or first illness that results in someone having to use a wheelchair. And then comes the second illness on top of that, which results from inactivity. That means the system isn't being used. As a consequence, we have to treat both illnesses. The basic principles to help patients like Kader came from space research. Expeditions into space have consequences for health. The astronauts move effortlessly because there is no gravity, but when no effort is used, the stimulation for the bone structure is missing. As a consequence, similar to wheelchair users, they suffer from muscle weakness and bone abnormalities. The reason is that due to the lack of movement, the muscles begin to atrophy and the bones are not used enough. And this sends a signal to the osteoclasts to remove bone material. It will be taken away from inside. This cooperation between muscle and bone makes biological sense. For this reason, we also speak of a functional unit. In nature, this means that in the body's biology, the functions that are used are built up, are strengthened. The functions that are not used are again metabolized, because actually they're not necessary. In the future, this will be prevented thanks to special training methods. The Center for Bone and Muscle Research of the Berlin Charité has found the Galileo System particularly effective for this. Basically, this consists of a vibrating plate. The company Novotech developed this instrument. It is also used here on Earth and is central to the new Cologne prevention and rehabilitation concept. The speedy whipping movements of the plate are particularly important. These activate the muscles. The effect can be observed not only in the legs but also in the trunk. This is extremely important for neuromuscular illnesses. The exciting thing about this therapy is that it involves automatic muscle spasms which are produced by this plate. This means that even when the patient has, for instance, nerve disorders and is not able to move his or her own muscles voluntarily, the movement of this plate stimulates contractions in the muscles. These graphics show in a simple way how these automatic muscle spasms happen. The whipping activates the so-called spindles in the muscles and tendons. The spinal cord is informed about the change of body position by the nerves. The spinal cord activates and coordinates the muscles for balancing movements. the muscle contracts. This is repeated many times and results in the build-up of muscle. Jasmine is at home. After learning how to work with the Galileo system in the hospital, she has been training with it for the last 6 months in her own room. She began in this position at an angle of 10 degrees and has now already progressed to 45 degrees. She exercises on the Galileo twice a day. It is a crucial pre-requirement that one can train using this method over a long period of time, and it is also an important basic part of our future rehab measures that the patient, in the course of the clinical treatment, learns how to work with this system and then continues with the therapy using the same system at home.
So, jetzt stelle ich an.
Kader still trains at the hospital under the supervision of physiotherapist Ingrid Dammertz.
Das will ich sehen. Nochmal. Ja, das ist gut. Okay, halten, nicht zurücksacken. Bleib so. Du merkst richtig deinen Ruck hier, ne? So, okay, gut.
She has made significant progress since beginning 3 months ago.
Indeed, most importantly, here when bending the knee, a lot has changed, and also, of course, the strength of the legs. At the beginning I thought I'll never manage it, but then I saw my knees getting straighter and my muscles getting stronger. You have already achieved a great deal. The dilation here is of course important to be able to stand and at all for walking naturally.
The patients get further supervision at the orthopedic hospital and in the Medifit Rea Centre. An individual training program is especially developed for each patient. Physiotherapists and graduates in sports science accompany the training. These additional therapies result in a variety of differing stimulations to the bone structure and musculature in order to achieve an improvement in function. Obviously, the children enjoy the therapy, which contributes markedly to its success.
I remember the first time that you came here, we did this exercise with the very, very small bags, but they were so heavy you could hardly pick them up with your hand.
The quality of Jasmine's life has really improved with her increased mobility.
I can sit, I can already crawl with my head up, and I can also sit for longer.
Ich kann jetzt auch länger sitzen.
Prima. Siehste, hast ja geschafft.
But that's not yet all, for her aim is...
I'd love to be able to stand and walk.
We can't promise all wheelchair-bound patients that come to us to perform a miracle so that they can stand and walk. What we can do is, using this new diagnostic system and therapeutic method, we can reawaken muscle and body functions. Functions which, especially if one is in a wheelchair, would not be used anymore in daily life. In the meantime, Jasmine has discovered that she does have the muscles that enable her to stand on her feet. And walking begins with standing.
Prima, die Füße stehen auch gut, Jasmin. Gut, so, guck mal, beide Hände habe ich hier. Beide Hände habe ich frei. Du stehst alleine. Köpfchen hoch, dann nehme ich dich. Okay, ich hab dich wieder. Gut gemacht.